Hello and welcome to this video on how to manage your back pain. Today I want to talk about the concept of a healthy back lifestyle. So although there is lots of advice out there on how to manage your back pain, there aren't really too many rules to follow in order how to do it really effectively. So there's no perfect way to sit or stand, or there's no perfect mattress for your back pain or correct pair of shoes you should be wearing. However, there are a few general principles and a few steps you can take that have been shown to reduce the risk of developing back pain and managing it effectively. So today I want to touch on the topics of movement, stress, and hydration. So in terms of movement, this is a really important and fundamental concept. So whether or not you want to prevent back pain or manage it, movement really is key. So this begs the question, what type of exercise is best for managing back pain? And fortunately, there is a clear answer to this question in the research, and that is walking. When we compare the effect of just going for consistent walks to fancy rehabilitation programs or expensive Pilates classes, in the short term, sometimes those Pilates classes or rehab programs can be more effective, but in the long term, simple walking is the best response. Beyond that, there is no clear best exercise for back pain. I know some people will tell you it's swimming or yoga or Pilates or whatever. However, adherence is the most important factor. The best exercise is the one you will enjoy and stick to consistently enough to reap the benefits. On the other side of the coin, contrary to what you may have heard or been told, no exercise is off limits for back pain sufferers. So if you have experienced back pain or suffered from even serious back pain, it doesn't mean you'll never run again or lift weights again or whatever you might enjoy. You may have to do some appropriate rehab or treatment before returning to these activities, but generally, if managed properly, people can absolutely return to these type of activities after a back injury. The second point I want to touch on is stress. Managing stress is a really important factor in managing back pain. So while the relationship between back pain and stress is complex and multifaceted, and stress doesn't necessarily directly cause back pain, it can exacerbate existing back pain problems and contribute to the development of future back pain through increasing muscle tension and increasing pain sensitivity. So it can significantly worsen back pain. So the best way to do this is, of course, to manage our levels of stress. Much easier said than done, I understand. However, in my experience, most people who suffer from back pain benefit tremendously on finding ways to reduce their overall stress. And I have two particularly valuable tips to offer you in this context. So the first is I would highly recommend engaging in some sort of active, ideally breath-based relaxation practice. So whether that be meditation or breathing exercises or gentle yoga and stretching, something like that, the modality is somewhat up to personal preference. Yes, we can of course de-stress by lying on the sofa and watching Netflix, or having a beer with our friends. That sort of thing is great. However, for back pain, the best results tend to be seen with some sort of active, deliberate, engaged relaxation practice. And the second tip is, of course, to just get moving. The spine loves movement and stress hates it. So getting up and moving, whether it's walking your dog, riding a bike, going to the gym, swimming in the sea, whatever it is that doesn't upset your back pain, this will give you the double benefit of improving your spinal health and reducing stress. The final point for today, hydration. This is good for musculoskeletal health generally, and also specifically beneficial for the health of your intervertebral discs. So in order to be optimally hydrated in terms of musculoskeletal health, you're looking at about 30 to 40 mils of fluid per kilogram of body weight. So I always use myself as an example because the maths is easy because I weigh about 100 kilos. So if you take 100 kilos and times it by 30 to 40 mils, that would be about 3 to 4 liters of fluid daily for optimal spinal health. And before you ask, yes, all fluid containing drinks contribute to your daily fluid intake, unfortunately, except for alcohol. Obviously water, juice, cans of Coke, coffee, tea, that all counts. Unfortunately, not a beer or a gin and tonic at the end of the day. So that is what contributes to a healthy back lifestyle. I hope you found that information useful. If you want some specific information on managing your back pain in the workplace, you can check out my video on that topic.